Perhaps administrators would like their behavioral health units to operate under the same models that oncology, nephrology, cardiology operate under. It really doesn't work, and they quickly abandon it. There's a high volatility in patient psychiatry, so it can be calm 1 minute, and within seconds it could be inflamed. There's never been really any good measurements developed for that, which is how we came into existence. Could we find a good way to measure it? And we can. And once we establish that, then we can look at all the other data, nursing data, staffing data, bed utilization data, admissions data, and we can bounce all that because we have a common way to measure it. It'd be like you and I trying to build a deck on the backyard, and if I was measuring in inches and you were using metrics, it probably wouldn't look very good. If we're all using inches, then that data starts becoming something we can work with.
Welcome, MedTech Gurus. Today, as I mentioned in the introduction, we're thrilled to welcome Jim Szyperski, CEO of Acuity Behavioral Health. Jim is a seasoned entrepreneur with a 25-plus year track record in building and scaling successful businesses in healthcare, technology, and manufacturing. Prior to launching Acuity, he led multiple companies through high-growth phases and successful exits, including roles as CEO of Medovex and partner at investment firms focused on health innovation. Now at the helm of Acuity Behavioral Health, Jim is applying his operational expertise and strategic insight into a critically underserved area, mental health. Acuity is using data and structure to deliver more consistent, accountable, and impactful behavioral health services. And they've just closed a $1.5 million seed round to fuel their growth. Hey, Jim, are you ready to be our guru today?
You betcha. I look forward to it. Thanks for having me on, Tom.
Oh, yeah, you bet. We're excited to have you. So tell us something fun or interesting about yourself or your family so we can get to know you a little better.
God, I think of myself as boring, but my kids all think of me as like a 12-year-old brain. So I would say, I've lived in Atlanta. I've been around the tech world a long, long time. I've got a lot of gray hair on it. But I'd have to say, think of all the fun things I've done before. At one point in my life, I was a DJ back in the days of vinyl and tape decks for a bar restaurant in Atlanta. And I did that for about a year, and I made more money doing that than I did in my bank job during the day. So that's probably I'm still a music fan because of that.
Mm-hmm. Yeah, I love music, and it's a really great way to relax and get your mind off things, right?
It is, definitely.
Yeah, for sure. So, Jim, Acuity Behavioral Health is doing some really important things at the intersection of mental health and technology. So maybe we can start off with what inspired you to start the company and what unmet need were you aiming to solve? Can you help us understand that?
Sure. I mean, I got involved in mental health care, probably 8 years ago in the tech side of it. And like a lot of people, it was for personal reasons. I have very close family members who have really wrestled with severe mental illness at varying degrees. And, at the time, I've been in the technology world, again, for 30 plus years. So I said, well, that's something. I've never been in healthcare. I've been in other elements. So let's give this a shot. How hard can it be? And it was it was a rude awakening. It's very difficult, but I got into it for the same reason a lot of people do. It's personal, and I think the older you get, the more important that becomes to you.
Yeah, that's so true, right? And it's that personal drive often that helps inspire that growth and that dedication. Because as you mentioned, it's not easy, right? And you
Yeah,
got to have that personal North Star sometimes to help keep driving towards. Correct?
that's absolutely. And I keep it. What's my alternative? Napping on the couch.
Well, that can help the mental health right there. So,
Yeah.
so that's funny. But and also in doing my pre-show research, I noted behavioral health can be complex and really fragmented as you look around at some of the healthcare systems and some of the outpatient things. So I'm just kind of curious as to how Acuity is bringing structure and accountability to the delivery of care, and then what makes your approach different. Can you help us out with that?
Sure. I think it's really interesting. I mean, healthcare, we tend to think of healthcare, and I'll use open heart surgery as an example. I mean, the first time we did open heart surgery in the 60s, the survival rate was de minimis, is 5%. Now this open heart surgery rate is probably 95, 98% survival rate. And it happened because People looked at the data, they looked at what happened, best practices evolved. And that's happened in most of the rest of healthcare. It has not happened in behavioral healthcare for a lot of reasons, stigmatization, certainly. But largely, I would say the lack of accountability, lack of structure, lack of standards and models that people can follow to collect data and aggregate that data, develop best practices out of that data, and get better and better at it. It's largely remained in people's heads. And if you literally go from hospital to hospital around our country today to behavioral health units, particularly inpatient units where our initial focus is, everyone does it differently. Everyone manages it differently. And that leads to a lot of variation. It leads to increased costs. It leads to very poor reimbursement models. All of these things are happening. So what we provide is something that was developed in concert with health systems, and we have health systems as founders and owners, is to try to fill that hole. Can we bring some discipline? Can we bring some structure? Can we bring some real data-driven type of results into the people who run and manage these units, which are largely nurses and nurse managers, and give them information that helps them not only manage what they have, but project what they need for the next day. Because they're typically oversubscribed, they're understaffed, they're underfunded. I can go down a list, and it's not a very sustainable model. So bringing structure and accountability with the way to answer your question is exactly what we're trying to do. We'll never eliminate all the subjectivity, nor do we want to. That's a very important part of the qualitative process. But if we can take that qualitative information and combine it with real data, then we can really do some powerful things. And that's what we're seeing.
Yeah, as a follow-up, you touched on something I was thinking about with that, subjective, influence here, right? Because that does have an impact on the data where you look at other disciplines like orthopedics, it's either a compound fracture or it's not, right? Where
Right.
this is a little more art than science. Is that part of the issue here?
It is. And I think it's largely because it's always been done that way. And, every other element of data or measurement, you're great one. Compound fractures, here's what you do if it's this bone or that bone or whatever you deal with. There's this kind of process in med school. People learn how to manage that. Same thing, if you're looking at cholesterol rates, if you're looking at cardiology events, there are things you look at and there's a process to doing it. And that process is far less defined or ill-defined, or in many cases not defined when it comes to behavioral health care. So literally, even though perhaps administrators would like their behavioral health units to operate under the same models that oncology, nephrology, cardiology operate under, it really doesn't work and they quickly abandon it. There's a high volatility in inpatient psychiatry. It's more akin to emergency departments in that respect. So it can be calm 1 minute and, within seconds it could be inflamed. And so there's never been really any good measurements developed for that, which is how we came into existence. Could we find a good way to measure it? And we can. And once we establish that, then we can look at all the other data, nursing data, staffing data, bed utilization data, admissions data, departure data for the patients. How are they trendlining? How are their outcomes doing? And we can bounce all that because we have a common way to measure it. It'd be like you and I trying to build a deck on the backyard. And if I was measuring in inches and you were using metrics, it probably wouldn't look very good. If we're all using inches, then that data starts becoming something we can work with. So that's really what we're doing. Trying to create a standard.
Yeah, gotcha. That's really helpful. So let's take it just a little step deeper then.
Sure.
Help us understand a little bit more about how your platform supports these providers in delivering a more consistent and measurable care, because really that's where the quality starts to come from, right?
It does. It starts with what we call scoring the patient. So part of our cloud-based technology, a series of algorithms that sit in the cloud, look at specific data on the patient records. And it's very specific about, certainly their diagnosis, certainly comorbidities that exist. But, what's their risk of falling? What's their violence scores? A whole series of things, probably 30 plus elements. We also combine that with information from the nurses who are the boots on the ground and the last people to see that patient on what level of intervention they had on the shift they just come off of. What do they think it's going to be for the next shift? And so we're engaging the nursing staff in something that affects their future and their coworkers' future in terms of how they're doing it. So the combination of that quantitative data from the patient record and some semi-qualitative input from the nurses forms a model. We then calculate that and ship that model off, and we score each patient on a scale of 1 to 100. So 1 being low, you're doing great. 100 being you're probably in constant surveillance. So that's the range we try to do, is establish a thermometer, for lack of a better term. And with that thermometer, I can now guide actions. I can now look at other events going on. What medical orders are coming down? What staff do I have on hand in which units? If these units have lower acuity than these units, then maybe I can move some people from one unit to the other. Can I step up or step down folks that we're looking at in critical care, can I put my right people on it in some cases? Again, at the end of the day, it's right person to the right place at the right time. Mm-hmm. And if you can predict that, which is what we're now doing with a high degree of accuracy, then that creates a whole different operational environment for the people who are heroes, frankly, in doing this every day.
Yeah, that's really interesting. And part of I'm standing here, I'm thinking, wow, this probably is leading some of your healthcare systems to some conclusions and protocols of care that they might not have thought about when they first started down this journey. Is that what you're seeing?
Yeah, I like to think is what we're doing is providing them information that some of which they might be able to find, and they went to here, then logged out and went to here, and then logged out and went somewhere else, and then had a pad and paper, could scratch it out. But combining that, pulling that, using AI in the background to pull that data together and inform them. So when I'm a new nurse coming up on a shift, I can see what's going on with the patients I'm going into. I may have a short summary. I can look at the historical trends of a patient, and I can see what happened here and know what changed, and look at what changed and which nurses were on staff then. Was there some event that occurred that caused a psychotic episode or something? So there's a lot of, it's really not only collecting the data, but presenting it in a fashion and in a dashboarding that is very simple for nurses and nurse managers, more likely nurse managers, to look at and help guide them. So we've seen great response from the nurses and nurse teams. I mean, this is something, as we tell them all the time, you have a big say. You don't have the largest say in what goes on in our calculations, but you have a big say. And as a result of that, we've seen drops in retention, drops in attrition, high retention rates, and fairly it's been well embraced. So we're really excited about that. It's really important. I mean, we are huge, and I personally am a huge fan of nurses. I mean, the nurses in psychiatric nursing and people who work in that are just unsung heroes. They really are.
Yeah.
It is a very difficult environment.
Yeah, for sure. And I want to just shift the topic here for just a minute, because as I mentioned in the introduction, you recently closed a $1.5 million seed round, and congratulations on that.
Thank you.
However, many of our gurus out there are entrepreneurs or soon to be entrepreneurs. And I'm wondering if you could share with us what best practices you've developed during that fundraising process, and then what advice you'd give other medtech founders raising early stage capital.
The first thing is get used to no. Because, if you're afraid of rejection, you're going to run into it. I don't care how great your idea is and how well received it is. It's difficult to raise money. It's in the last couple of years, it's much better now than it was a year ago or 2 years ago, especially. But it's hard, particularly in early stage venture funding. It's difficult. So, as what's the line from The Devil Wears Prada? Gird your loins. I mean, be ready for it. It's hard. The other thing is, however smart we think we are sometimes, the smartest people are the ones who are actually using what you're trying to do. So if we can all, take a moment, which is difficult for me sometimes, and, use 2 ears and 1 mouth for a reason and listen, then some of the greatest ideas will come from the people you're actually trying to help. They know it. Once they understand what you're doing, they have a really good sense of how you can help them. And if you can listen to that and incorporate that, then you're going to end up working within the system instead of trying to push something in from the outside. And that's really important. And if you can find a partner who's a health system, we were fortunate to come out that way, then you're inside the castle. You're not trying to storm it from the outside. So I would encourage anyone out there who's trying to raise money in medical world, find a partner, go to some of the health system venture groups, work with them, get it embedded, get it in their health system, get it in the workflow, because they're the two big obstacles. Selling into the health system, huge issue to start with. Secondly, getting it into the workflows of the people who are going to use it, because if you don't, they're not going to use it and you won't be there long. So those were the words I advise. Be patient, be persistent, and really do the best you can to work with the people who are going to be your users.
Yeah, that's outstanding, and it leads me to a couple of other questions for you. Because first,
Sure.
I liked that listening component, and what I took away from that is that by listening, you can take some of those stories, some of those outcomes, and use that in presenting to other potential investors, right? To be able to paint that picture of this is where we're going. Is that heading down the right path?
Absolutely. I mean, the best ideas come from them. And it's nice to be able to say in a presentation, like, I think we thought of this and we're really smart, but we didn't. This came from our users, this idea. And here's an example one. Here's an example two. So even if it's an early stage idea and you're in the early phases of it, you can have a real world conversation around what it is you're doing and what you've seen to date with the people you're working with.
Yeah, that's awesome. And then, the other question I had with it is, kind of listening to that, a lot of the gurus that we've had on our podcast here have often struggled with getting engagement with, clinicians and then retention, right? But it sounds like through this process, you're ensuring the patients and clinicians both get involved and stay engaged. Is that what you're finding?
Yes, I think some of that is, we have a pretty experienced team. I mean, first of all, and I'd say this to anybody out there, entrepreneur, it takes a team. This is not something you can run off and do, and none of us are smart enough to try to do that. But our team has been around and we've all a kind of experienced group. And we understand that the best way to make impact is to do just that, to work with the groups that are there, the people that are going to be your end users. Again, they live this every day and they know what they need. And your job is to help them understand what you have is something that can inform them better, help them make better decisions, help them allocate whatever resources, which are typically limited in this environment, to the best they possibly can. And show a good path forward for them. So that to me is, I mean, some of that's maybe some level of maturity, despite what my wife and children say over the years, and having really being thoughtful about how you go about this, and realize that nothing moves fast in healthcare. It really doesn't.
Right.
Unlike any other industry I've been in, and I've been in some big ones, most of them, healthcare makes them look like greyhounds. So it's very slow, and that's your environment. But it can be really impactful working with these people and rewarding.
Yeah, for sure. And I like that comparing the other industries as greyhounds to healthcare, right? Because you've had a lot of experience with strategic partnerships in some of the other areas of industry that you've worked with. So, for our gurus out there, when they're looking at this healthcare system, tell us about some of these partnerships, the clinical, technical, or strategic, and how have you got them engaged? How have you gotten them engaged, and how have they been so critical to your growth? Can you shed some light for us there?
Yeah, I think, we're fortunate in some extent that we've evolved this with partners that were health systems to fill a gap, to fill a white space. Marketing people would call it maybe building a category here, where you're filling the pothole. It's a big pothole. It's in the middle of the road. And it's causing financial distress to all the health hospitals that are in this. So how do we relieve that? So we were fortunate in some extent to get there. But I'd say there are probably other opportunities like ours in different areas of healthcare where it may seem, everyone's kind of looking, how do we do business to consumer? How do we get, more consumer this, consumer that? And to some extent, and I think that's great, by the way, don't get me wrong, particularly in behavioral health care, the more the better. But on the other side of that, the people who are providing that help to you, providing that services, if you have friends that are in healthcare, if you have contacts who are in it, if you have an idea and you can get to the right people or ask them to connect you with the right people, find out, would this be helpful? Does this work? Is this something, if we put something together, could we pilot it with you? Could we do it in collaboration with you? Anything you do to kind of get your foot in that door, I would advise.
Hmm. Yeah, that's really helpful, right? And I'm also wondering, that initial approach, right? Because the healthcare systems are huge, right? In billions of dollars worth of purchases and spend, and as you're coming as a startup, did you develop any techniques? And I might put you on the spot with this, but did you develop any techniques to get them to tap the brakes and listen to you for just a minute?
Yeah, well, I think, first of all, I think it's some homework.
Hmm.
And I'm old school, so I still try to do my homework when I'm trying to call on someone, even if it's someone new we want as a customer. Who are the people who are in these areas that I would impact? How can I get to them? Do I have people that I know that know them? Somewhere in my network, how can I get introductions to at least have the discussion? So identifying the right person is first and foremost. And I would say, well, health systems are huge. Within those health systems are these mini castles, groups, whatever you would want to call them, that might be in cardiology, that might be oncology, they might be in behavioral health care. So while the health system itself can be overwhelming, when you kind of narrow it down to the groups you want to talk to, it may be less daunting to do that. So if you can, and I think that's just research. And I think, if you have an idea and you say, well, I think I could really do some things to help ABC, then doing the homework around that, it will save you and people you're talking to a whole lot of time.
Yeah, that's great advice. And then one of the other questions I wanted to ask you is scaling, especially behavioral health, is no small feat, right? I mean, you were talking about the time factor here, how healthcare moves slowly. So I'm wondering what strategies you're using to expand access, but at the same time maintaining quality and clinical oversight. Can you help us out with that?
Yeah, I think, and fortunately, healthcare does move slowly, so this is less likely to occur, but outrunning your headlights. I mean,
Hmm.
your first sale shouldn't be to an HCA. I
Right.
mean, you will be swallowed, gobbled. They've done companies 50 times your size, for breakfast. So you have to be careful and thoughtful about where's your entry point. Where do you want to start? Where do you want to prove whatever it is you're trying to prove out, and do it thoughtfully and methodically, even if that's painful because it's taking a while. It's worth it because then you get the buy-in, then you're doing things the right way. So I think first of all, realize it's not going to move fast and be thoughtful about how you go about it. Be careful about what you wish for in terms of the size of the folks that you do, because again, we're small boats out in the lake and we can get swamped very quickly. So being cognizant of that, you know, and thoughtful about how you schedule things and how you make sure first and foremost that there's trust. Your stuff has to work. If it doesn't work and you're kind of spitballing it and demoing it in there, you're going to take a hit.
Yeah.
And all of us do at some point. Something goes wrong, it's how do you react to it and how are you on top of it? But if you don't ever go into something knowing that, well, we can probably disguise a couple of bugs here and there, or we can do this and get something, you will pay and should pay a real price for this. These are clinical, at least in our case, clinical environments. There's no screwing around in that.
Yeah. Yeah, and I would think that your investors are probably important in that process then as well, to have a little patience, but also to realize how you're trying to scale and make sure that you've got all the protocols in place, correct?
Correct. And I would say, if it's a hosted, which most things are now, if it's a B2B or even B2C, it's probably a SaaS or related offering. It's probably sitting in AWS or Azure. Um, is it bulletproof? Is it up there? Do you have redundancy? Do you have all the things you need to have in place? Do you have a good ticketing system in place? How are you communicating? If there's a problem, how are your customers communicating with them? What's your response time to all of those things that are just critical to having anything scale up? And that includes, doing your load test or being able to bring additional resources in if things do start to take off. That's not stuff you want to figure out on the fly.
Yeah.
And although it's probably less likely to explode like that in healthcare than it would in maybe financial services or some other area, it can, and you just try to do the best you can to be prepared for that. Again, that's why it's nice to have a good team around that you can all with different skill sets, pick people smarter than you are, which I've been very fortunate to do, and listen to them, and because they know. But scaling is a challenge. It's less of a challenge, I think, in cloud-based as long as your stuff works. So make sure whatever's your building works. We work with AWS; they're great, and they're very supportive. So, and you can never, as you know, you can never project everything is going to happen. You're just going to get every now and then something larger than a big acorn will fall out of the tree and hit you in the head that you never saw coming. But it's,
You said what I think is really important with that is it's how you respond to those little challenges or big challenges, right? And your clients are seeing that you're proactive, you're involved, you're transparent, right?
It's trust. I mean, you really, they trust you to do what you say you're going to do. And I think if you can build that level of trust, then, you're going to have a great working relationship at all levels with the folks that that are using your technology. And so getting case studies or getting things out, ask them to help you with that. Typically, they're more than willing to do that.
Yeah. That's fantastic. So, Jim, this really seems like an exciting time for Acuity Behavioral Health. What does the future hold? Where are you going from here?
We're in a number of health systems now. We have plans to expand to hopefully several times that number by the end of the year. The real goal is to create a standard here. Can we create a standard way of measuring and managing inpatient operations to start with? Because that's it's the lowest performing financially sector of the hospital, and that's not sustainable. So we got to fix that first. And if we can show that, yes, we can measure patients and we can know how they're doing at any point in time, we can longitudinally track that. Does that provide better capabilities for partial hospitalization programs, intensive outpatient programs? How far can we extend that out? Because it is a very comprehensive measure of not just how the patient's doing, but the skill level and the amount of time that staff needs to spend with that patient to really get the best outcomes for that patient. So it's continuing to scale up, to continuing to add, and eventually kind of stepping outside just inpatient, maybe into ancillary parts of the road here that we can get on without kind of deviating from our overall theme to really kind of improve the way which it desperately needs we manage, clinical operations in behavioral health care.
Yeah, that's fantastic. It sounds like a lot of terrific opportunities coming your way. So, Jim, I'd like to acknowledge and thank you for the time it took for you to be our guru today and all the terrific insights that you brought for us. If somebody wants to connect with you or learn more about Acuity Behavioral Health, how do we do that? Is there a website? You on LinkedIn? How do we learn more?
Sure. All the above. We have Acuity Behavioral Health on LinkedIn is one way. Our website is Acuity BH, Behavioral Health, acuitybh.com. And you can go to that. Or just if, you can send to info@acuitybh.com and we will respond, I promise you, very quickly. And I want to thank you, Tom, for having us on. I mean, this has been great. Yeah. I'd look forward maybe to seeing you sometime in the great state of Michigan.
Yeah. We hope so, somewhere around the lake. So, Jim, once again, we really appreciate your insights and thanks for being our guru today.
Tom, thank you. Have a great day.
Thank you. Thank you for listening to MedTech Gurus. I am Sylvester Harris, your MC. If you want to learn more about Tom and his consulting services, you can go to www.pctmedical.com or email Tom at tom@pctmedical.com. Now, I can be reached at Sylvester Harris, that's SylvesterHarris 5048@gmail.com, and I'd be pleased to discuss any voiceover work that you may want for your company or broadcast. Hey, thanks so much for listening, and catch us on the next episode of MedTech Gurus.